I just wanted to introduce Jen Shockey. They're a provider training and education manager for the UCSF Alliance Project. And for those of you who aren't aware, because UCSF is a very large place, the mission of the UCSF Alliance Health Project is to support the mental health and wellness of lesbian, gay, bisexual, transgender, and queer and HIV-affected communities in constructing healthy and meaningful lives. So the way they go about doing this is to try and decrease health disparities within the LGBTQ and HIV-affected communities, try to provide the highest quality mental health services and substance use counseling. And they really want to grow a diverse and culturally competent work environment that really supports the staff in doing this work. And then ultimately translating frontline expertise and research findings into both interventions, publications, and training to broaden the effect beyond the local community. There's some values that really guide this care, and it's really focused on the individual needs of each person, helping individuals maximize their existing capacities to undertake the challenges they're facing. It's really focused on enhancing health and wellness, working on the individual's vision of a healthy and meaningful life, and really doing this in a culturally competent way. So more about our speaker, Jen. They've worked at the Alliance Health Project since 2012 as a trainer, capacity building assistant specialist, and curriculum writer. Jen became the manager of this training education unit in 2018. And prior to that, they worked in HIV and Hep C prevention since 1992, really through a variety of things from testing, counseling, community outreach, syringe exchange, and program management. And they have extensive training and teaching background in LGBTQ plus topics, including trans health, diversity, and inclusion. They also conduct trainings for the National HIV Classroom Learning Center on high-impact prevention interventions, such as personalized cognitive counseling, healthy relationships, HIV testing, in both clinical and non-clinical settings. And we're so lucky to have you join us at this early hour, and we really appreciate it.
The rest of my training team was like, "Oh yeah, that's too early." I was like, "We can do this." Well, it's a pleasure to be here, and I appreciate y'all for showing up and being here as well. And I have some slides. I'm going to share my screen. I'll get started because I know time is of the essence for you all, and I don't want to waste your time. But I do appreciate you being a part of this. From my understanding, it's a DEI monthly program that Dr. Ravi started, or with some others in your department, which I think is amazing. And, kudos for that. That's totally needed throughout UCSF. I wish all departments, I think a lot of departments are doing that. Same at Alliance Health Project. We've been working on our anti-racism work and trying to make our agency even better. When you read all that stuff, I was like, "Oh, wow, these sound really good." But everyone can always learn and learn more from each other. So I appreciate this invite today. So I'm going to share my screen and see if I don't mess this up because it's early. All right. So I am not that fancy. I'm a one-screen person, and so I can only see some of you on my screen. And if I miss chat, I might ask Dr. Zimmel if I can, if you don't mind, if you see something and I missed it, please let me know if there's a question or anything like that. And I'll do my best to catch it, though. Well, welcome. Thank you again for the invitation to be here today. I was trying to come up for a title for this. We have different titles for different things, and then I broke it down to this: Pronouns Matter, how to use inclusive language for your LGBTQ plus patients. And I just sort of wanted to start it off with, you did a great intro to me, and so I'm not really sure where to start with that. I had an intro in mind, but I'm going to do what I have, and it might be repetitive, but so good morning. Hello, my name's Jen. My gender pronouns are they, them, and theirs. How can I help? So this is simple welcome is what I wish all of my healthcare providers would do when I walk into any clinical or non-clinical setting. It's a simple introduction, but it kind of makes you really feel comfortable, at least for me, to then share maybe a bit more about myself. And so this is one of the reasons that I really enjoy doing the talks like this today, because I feel that they're just really important for folks who work in any type of health field. And some of this you might be familiar with, and that's okay. I think a refresher is good every now and then. So if I'm repeating something you've heard, maybe you'll go, oh, right, I forgot about that. And Dr. Zimmel did a great introduction talking a little bit more about me. It's true, I am the manager of the Provider Training and Education Unit here at UCSF Alliance Health Project. And our training unit does do trainings like this when we can around LGBTQ plus kind of topics. But we're also funded by the Office of AIDS. And so we certify folks to be in like finger stick and rapid test kit proficiency trainings around HIV, Hep C, and STI. And like what was said, we also train folks nationally around high impact prevention interventions with the National HIV Learning Classroom Center. And it's true, I've been with AHP going on about 12 years now. And my primary experience has been in the capacity of working in HIV prevention. But I've also had opportunities to teach a trans health and transphobia class when I did some work at City College San Francisco. And just to tell you a little bit more, I identify as a non-binary, genderqueer, gender non-conforming, and I'm a retired drag king. I just like to throw that all in there to kind of encompass who I am. And I do use they, them, and their pronouns in my everyday life. I have a beautiful family. I'm married. I have a wife. She uses she, her pronouns. My two stepkids use, well, I don't know which pronouns they're using today. It kind of changes, which is awesome because I think the new generation today, they look at life a little different. They have more access to things. And their community of friends look at gender and gender identity and sexual orientation in lots of different ways. So sometimes I learn new things from them, to tell you the truth. So that's a little bit like how I like to get started with this. And really, because this is not super long of a talk, I'm kind of highlighting a few things here. I'm going to start with some basics just to make sure I know where we all are coming from. And then talk a little bit about how do we maybe, graciously correct ourselves when we're misgendering somebody. And also talk about some possible best practices for communicating with and welcoming LGBT plus individuals where you work or even with your colleagues, because some of this stuff all overlaps. So here's a question for you. Sexual orientation sexual orientation and gender identity are the same thing. You can give me a virtual thumbs up or thumbs down if what is that statement? What's your reactions to that statement? Sexual orientation and gender identity are the same thing. Yes or no? Am I seeing thumbs down, right? Or am I seeing some thumbs up? And people are like, I'm on my phone. I can't find that emoji. I don't want to go on screen. And that's okay, but you could find the emoji. I don't know, Dr. Zimmel, are we seeing a lot of thumbs up or thumbs down? Because I can't see everybody on my screen, unfortunately.
I'm only seeing thumbs down.
Oh, I'm excited that this is going to be a refresher maybe for some of you. Well, I appreciate that. So you have done your homework. Thank you. Well, because there's so many, terms that we use. And some of these terms that are on this slide, you're probably very familiar with, which hence we call it the familiar model. And so when we hear the word lesbians, gay men, bisexual people, those are words we probably are familiar with. We might equate them to a sexual orientation, who people might be attracted to, right? And then when we hear the word queer, sometimes that it can encompass a lot of identities, and sometimes it's used as a shorthand for anyone in the LGBTQ plus communities. Like I like to use the word queer for myself. So it can include both sexual orientation and gender minorities, just like sometimes the term sexual gender minorities. And sometimes it's used to describe just LGBT people, like lesbian, gay, bi people, or other sexual orientations. But something to also keep in mind when we hear the word queer, because I think people think they can just use it however they like to use it. There's actually, even within the LGBTQ plus community, there's a little bit of difference in generations at times. And sometimes the word queer can still have like that negative connotation because it has been used as a derogatory for a lot of folks who maybe grew up in the 50s, 60s, at a time where things were a little different. And I think that term has been taken back by a lot of my generation and maybe, going forward. But again, language is constantly changing when we think about identities in the LGBTQ kind of world. And so I want to kind of highlight a little bit, focusing kind of on the trans, and cis folks and kind of what does that look like when we think of identities, because today I'm going to talk a lot more about probably in that world of gender identity when I think about pronouns and how people use pronouns. So that was the familiar model when I think about all those terms I just sort of highlighted, but times have changed. we are, lighting matches to the little sticks that tell us if you're a boy or a girl. This slide, I love it because it's got that little person up there. It says, are you a boy or a girl? No. Are you a boy or a girl? Yes. Are you a boy or a girl? Well, what day is it? And then, are you a boy or a girl? That's a great question. And that's kind of how it feels like sometimes when we move through this world. We can't ever really assume what's going on with how somebody might identify. And it can change. That's what's also awesome about this too. I feel like people think, oh, well, you've changed your identity, your gender identity, that must be what it is. But to tell you the truth, some people move through the world and the next day they're like, I feel like maybe I'm going to take my she, her pronouns back. I'm okay when people use those, but I also like they. And so that can get, I think, confusing for folks because then they're like, well, which one do I use? And we'll get into that. And so, it's all about I like to say gender is fluid, sexual orientation is fluid. And this is a quote from an author, Dylan Vade. And they said they kind of looked at gender identity particularly. So not just looking at male, female, but beyond that, that it's like a galaxy out there. And so on this slide, there's a lot of identities, and I am not going to define every identity out there for you because that's just crazy pants, because an individual is an individual. And I am actually one individual today who identifies as gender non-binary and genderqueer and all those things I mentioned earlier. And I use they, them pronouns. But my identity cannot describe what it's like. I can't be the person that's everything for everybody, right? For one, I'm a white, gender non-binary person. And that right there says a lot when we think about intersectionality. I cannot describe what it's like to be a Black trans person or Black trans female male person or Black gender non-binary person or any other, identity. And so I just want to make sure we understand that everybody comes to this from different places. And so if we think of it as a galaxy, as Dylan says, it's a big space in which everyone's gender has space and in which our genders are not hierarchically ordered. Because in this society, because we live in this binary world sometimes, because that's just how we maybe grew up, we have this hierarchy of how gender is sometimes, and thinking about what that looks like. And so this next slide you may have seen before because I think it's used a lot, but it does a good job of kind of breaking this all down to kind of get us on the same page. How many of you seen the gender unicorn? No? Have you all seen it? Yes, Natalie, I see one hand. Some people, has anyone known? Not everyone's seen it? Okay, well, the gender unicorn's a lot of fun. It's one way to kind of break down when we think about like our, where we see ourselves here in our head, our heart, and, down there. So when one thing that I always like to start this off with is, so what is it that most folks ask a pregnant woman? What is that thing that the first thing? You all might be a little more advanced, but what do you think is the first thing people usually ask a pregnant woman? What do they think they used to? Maybe not today anymore. You can throw it in chat, and let me see if I can find my chat. Oops, it's going to see. Boy or girl? Yes, thank you, Rosanna. You get the prize. If I had one, I'd give you one. So it's true. Usually boy or girl is what most people are thinking, like, oh, is it going to be a boy or a girl? And then we have those great things people do now where they shoot off pink and blue things. Uh, that's a whole other talk show I won't get into. But it, so most of society really moves through this gender unicorn with the idea of there being one gender binary, which is male, female, or boy, girl. So, for example, if someone's assigned female, it's supposed to, according to the binary, you should have a feminine expression, your gender identity is female, and you should be physically attracted to men. And as for emotionally attracted, most might say to just cis women. And this works for a lot of folks who are cisgender and who identify as transgender too, who want to be in this binary world. There is nothing wrong with it. And I think that's important to note as well, because I think sometimes people think, oh, it's bad that I'm that. It's not about that. It's just understanding that it doesn't fit everybody, right? And so I'll use myself as an example just to kind of walk through the little unicorn here. So let me see here if I can click this correctly. Let's see if it'll work. Oh, there it is. So when I think about me, so when I came out of the womb, the stamp that was put on my birth certificate was that I was an assigned sex female, right here. So that's kind of what my mom was told. And then, so when I think about my gender expression though, so that's kind of like, how do I move through the world every day? My gender expression kind of moves between the feminine and masculine. So I wouldn't say I'm like all female and all masculine. I kind of move through it. Maybe it's how I dress. Maybe it's how I express myself. Mannerisms, I do drag, there's different ways we can express our gender, and gender expression has changed, when women started wearing pants, that was like, oh gosh, oh, that's a big change. So, thinking of it like that. So gender expression can be fluid. You can move through that. Some days you could feel a little more feminine. Some days you're more masculine. But for me, it moves in a little bit of both. And then I clicked too early, but my physical attraction then primarily I would say is to women, cis women. But it doesn't mean that I hate men or don't like men, that I'm not physically attracted to men, and that I'm not physically attracted to other genders. So when I say other genders, so like I'm saying, not everybody fits the cis men or women, cis women world, right? So there's other genders. So I could be attracted to a trans man or another gender non-binary person or trans women. So that's just like how I move through this world. And then, when I think about my gender identity, I do use they, them, their pronouns, because for me, that fits more in my gender identity and in my kind of gender expression. It moves a little bit more kind of a combo of all those things. I don't feel all female, I don't feel all male, and could be a variety of genders depending on the day. So that's kind of like how I see my gender identity. And the same with emotional attraction. I sort of just put it in the middle. I like people. I have emotions with all people. I'm not just emotionally attracted to just women just because I have a wife or a spouse is another word you can use, but my partner is okay with wife. When we got married, it took me a minute to go, oh, we're not partners anymore. I can say wife, or I can say spouse, or we had to like, I'm like, what do we say? She calls me husband, so that works great. I love it. So that's just to break that down to gender thing, another gender breakdown. Um, and so to kind of close this, really what's important here to keep in mind is that gender identity does not equal sexual orientation, which you already knew, and that we can't tell by looking at a person how they identify, since it's different for each person who walks through that room, And you've probably seen this being providers. Everybody you see, you just can't assume what's going on in their head around their gender identity, because we all move through it very differently. And so just for fun, I'm going to ask you, just, in your own mind, can think about, where does your star shine in the gender galaxy or in the gender unicorn? Do your self-reflection on that, and like think about, how would I walk through this world, and how does it look different maybe from my patients or my colleagues? And have I ever really looked at that for myself? Just think about it. No big homework there. Just think about it. I like to sometimes have us like put ourselves in the shoes of others to kind of get that awareness, that maybe we haven't always noticed it. A lot of times when we do this too, I think about bathrooms, and when we walk to a bathroom, if there aren't gender neutral bathrooms, which one would you use? If, which one do we always end up using? And on that note, I was just at Disneyland last weekend, and we were in the fantasy land, and I'm like, oh my God, the bathrooms are called Prince and Princess. I was like, well, what if you're not a prince or a princess? Which bathroom do you use? I was sad. They had some companion bathrooms, I'll give them that. But anyway, just something to think about. I mean, I do like to be a prince or a princess every now and then, I won't lie. We all have that in us. All right. Are we doing okay? Yeah? We good? Okay, Dr. Zimmel? No comments or questions. Okay, thank you. Just want to check in. Okay, so pronouns, they matter. This talk is timely. It's actually International Pronoun Day on October 18th. And if you're with UCSF, you may have saw some emails. If you're on UCSF LGBT Center, there's a center on campus here. They're doing some activities around it. So if you're not on that listserv, you could see things that they'll be doing around International Pronoun Day. And I have to give UCSF some credit, because they have done a lot of work around pronouns, which is pretty amazing, which is probably why you might know some of this already. So I give them lots of credit. It's been a work in progress for a lot of big institutions. So grammar. I put this up here because gender pronouns are actually, it's grammar, right? And a lot of people get a little like, oh, they and them, I don't know how to use that. How do I use that? Well, I think, was it Webster? I don't know, with somebody that it's like an approved like you can use it in a sentence. It's not going to mess anybody's language up or English. But if you're a big grammar person, it's really hard sometimes. But really, when in doubt, just use a person's name. That's really talk over. Okay. No, it's really about that. Or when you're introducing yourself, simply say, my pronouns are they, them. What do you like to use? And kind of what I did in that first intro slide where I said, hello, my name is, gave my pronouns. Even if you share your pronouns and you don't ask that follow-up question, what do you like to use? That can be a big opening for a lot of folks to feel comfortable then saying something, if you're not already gathering this information in a different way. But it's about this lovely thing called grammar. And, a lot of people are like, oh, why is finding out and using a person's correct pronoun so important or such a big deal? Like, why does this matter? And there's some important things behind this. It's about, pronouns can act as like a signifier of someone's gender identity or gender expression, right? It's a sign of respect. The correct usage is a way to show respect to cisgender. So not, I'm going to put everybody in here, cisgender, transgender, and gender expansive individuals in our communities, with not only your patients, but with yourselves, with your colleagues. And then, not everyone uses pronouns. And again, just so I think that's important to think about, because I think there are people who just would prefer you use their name. And the default, if you're not sure of somebody's pronoun, sometimes is to use the they, them pronoun. And I actually got in trouble with that once because I defaulted to the they, them pronoun for people. And I realized that's actually not the pronoun they used. And you have to like sit back and go, oh, whoops. Just because I use it doesn't mean everybody else uses it, right? And so again, sometimes just asking a person's name or what name would you like to use. I actually had a doctor's appointment this week, and I go to the UC Davis clinics here because I actually live in Sacramento, and so I could use the clinics here. And the doctor came in, and he was so fun. He goes, and then he goes, oh, what name do you use? I was like, wait, did you just ask that? That's amazing. That's a good question to ask. Thank you. And, I think the other reason this is a really big deal too, is I think about pronouns can improve a person's health. They're a sign of being inclusive. They also, address microaggression. Not using the correct pronoun or misgendering someone can be a little microaggression that, those subtle interactions that perpetuate discrimination against a minoritized group. That's, what a microaggression is. And a lot of times when we're, hearing a lot of like incorrect assumptions made about an individual or group over, a lot of those little ones over time and time, they really just start to they hurt people. Because there's a point where you're like, I'm so tired of correcting you. You just get tired of correcting that person. And you just sort of give in to okay, I'm not even going to tell them again. Please don't. You could stop mamming me. I've been mammed many times. And, you could use y'all or folks or, other words, but being ladied or, all those words that maybe you don't like if you're a cis woman too. I don't know. But the words that people sometimes use over and over, and you're just like, oh, do I have to explain to you that does not fit every person? Please, I'm not a ma'am today. Okay. So thank you. But that can be tiring. So those microaggressions can be really hard on a lot of folks in the gender, non-binary, transgender world. And a lot of folks sometimes are not just dealing with pronouns as one thing. They could be, other microaggressions that could be happening to them that kind of compound it. And speaking of how using the correct pronoun usage in healthcare and clinical settings can improve one's health. A good friend of mine, Dr. Sebelius, he's done a lot of research and I might have sent one of their research articles. I can't remember if I sent this one, but one of their studies that they had done around correct pronoun usage and gender affirmation, really showed an improved mental health and well-being among, particularly this was with trans women. And, I work in HIV. So, and Jay does a lot of work in HIV. They looked at HIV and there was a real association with viral suppression among individuals living with HIV just by being treated with respect, right? And using correct pronoun usage and affirming one's gender as they walked through, seeing a provider. Because, incorrect, as it said, what they found is that incorrect usage can lead to anticipation of stigma. And this is the big part, is people avoid care. They just don't go see a provider. It can take one little not using the correct pronoun, not affirming one's gender, And maybe they've been trying, and it could take, like I said, those microaggressions come into play, and then they just stop going. And that's not what we want. We want people to feel comfortable getting care. Everybody deserves care. Transphobia is not cool. you know, um, we just need to treat people with respect and affirm the gender that they're presenting to you at that time. And it can change. And then how do we still be respectful and understand where that person's coming from and still give them the best care that they need? So just thinking about that when we think about healthcare settings. So I'm going to shift gears a bit. I'm going to ask you, well, you can raise your hand or you can put your thumbs up or thumbs down. I'd like you to think about this. Please raise your hand if you have ever misgendered or you have ever misgendered someone else, or like you've been misgendered. Sorry, it's very early. You've been misgendered. Raise your hand if you've been misgendered. I'm raising my hand or my thumb. I've been misgendered. Or have you ever misgendered someone else? And if you don't raise your hand, that's okay. Just think about it. But yeah, I've also done that. I've accidentally misgendered someone before. So we all do this, right? Thank you for sharing that. I appreciate it. So just think about that. And as you're thinking about that, take a moment and reflect. How do you react after making a mistake? Like, what comes to mind? Like, and if you want to share it in chat, you can. But how do you react after making that kind of mistake of misgendering someone? Oh, I missed the English grammar thing in the chat. Well, I just want you to reflect on it, just thinking about that. Check my time. Because that's usually where people get kind of stuck with when we think about misgendering folks, where a lot of times when we make a mistake, the thing where people, they start to kind of go, oh my God, I am so sorry. And you could do this in your head or you say it out loud. And then you might follow up with, I really care about pronouns. I'm just trying so hard. I'm not used to it. Forgive me. That makes it such a bigger deal than it is, right? Like, but that's kind of where we go. Cause we all come from, we're the work we do or the work you do, you come from it because you care about people, you are empathetic people, so really it's more about just treat it as if you mispronounce someone's name. It's a little disrespectful, so be sure to be sensitive, but it's ultimately no big deal. Just acknowledge what happened. I think that's what people don't do, or they over acknowledge, right? Apologize, and have a redo, and then try not to do it again in the future as best you can, right? And that's really what it's about when we think about what do I do if I misgender a non-binary or trans folks. And, we kind of, I break it down a little more with, when we're thinking about how to respond to misgendering someone, keep it concise, center the person who's been misgendered. It's an immediate correction, and it's an opportunity for your self-reflection. Like, what just happened? What happened? How can I do this differently next time? It's really simple. It's like, hey, I just realized I used the wrong pronoun for you. I'm sorry, and I'm going to do better next time. It's super simple like that. And go from there. And, we like to we use this a lot, where we like to say, remember that it's a gift, even if it doesn't feel like one. When someone tells you that you have misgendered them, gender minority people get misgendered like all the time. And, we have to pick and choose when to say anything, because it's so hard, and to say something every time it happens. And that's so true. Many people only say something if they feel like they have some kind of relationship with the person who misgendered them, that they're likely to have more than one encounter, or they want their interaction to go well. And, people are sometimes moved by cis people who demonstrate a clear interest in doing better. It's just a gift. And so I leave you with that piece, with pronouns, a little bit of how we just kind of look at that when we do misgender somebody. And I think I have a little time. And I'm not missing anything in chat, right, Dr. Zimmel?
No, I think that's good.
Okay, thank you. I just want to check. And so a few more little things I wanted to give you before we leave today is just, and some of this you might be doing now. I'm not saying everyone's pronouns in their Zoom, but we'll get there. Simple things you can do. So add your pronouns to your Zoom handle. We do this a lot in training. We're always telling people, hey, take those little dots. You can rename yourself. We do this all the time. Email signatures, UCSF's been big on that. AHP, where I work, we just started doing that, I feel like, not too long ago. When I first started at AHP, we did not have pronouns in our email signature. It's kind of amazing what happens over, when things change through society, and other places do it. Web profiles. You are doing the second one, training yourself. Sounds like you have a great DEI monthly program. Dr. Ravi had given me some other titles that you all had been getting trainings on, which is amazing. I don't know if you do this where you work or can do this, but sometimes people look at their policies and procedures. What is there some LGBTQ plus inclusiveness there? And then other best practices. A lot of times people, if you can do this, I don't know where you all work, but simple things like, what does your decor look like? Is it reflective of LGBT plus people and couples? Avoid using just those images of heteronormative couples, because I think that's what most people always see when they go to places. We don't have to just have these things in just LGBTQ plus agencies like where I work. It needs to be a variety of people should be seen in waiting rooms and things of that sort. And do you all do this already? I know a lot of places have already been using SOGI. Do you have forms that let somebody identify their gender and do the two-step? Do you all do this? Or do you know if you do this?
We have the SOGI forms implemented in our version of Epic. It varies clinic by clinic. It varies clinic by clinic exactly how that information is collected at a visit.
Okay. Well, this is something that maybe you all could think. It's simple, but Epic, that's true. It's probably in Epic, but it's whether or not it actually gets done. Right. And actually, I know UCSF, different departments do these things. And I will say, and I'm going to use myself as an example again, but when I went to UC Davis clinics here, primary care though, they had me fill out a bunch of forms. And I remember the first day I went there, they gave me these forms, and it was this plus all these other questions about my pronouns, the name I wanted to use. And I was like, I had never seen that before. I was like, this is the first time I think I went to a provider where they actually asked me all these things that wasn't just, one or the other. And I believe that all went into my Epic, into my electronic chart system. So just something to think about if you're not doing this, because this can help sometimes a provider too, because when we're asking questions, we want to make sure we're asking questions appropriately that will fit this. And if a provider can look at this, that might allow them to then ask the client, the patient or the client, which pronoun do you use, or what name would you like me to use today? So that's something to think about. And just really quick, there's a lot of terms that can be really horrible too. And unfortunately, in this political climate, we've heard some of these words around, especially the trans community. I think language like transgendered. And so there's terms evolve over time. And just as like LGBT people were called homosexuals in the past, then gays, and now there's an understanding that you don't use the word for the sexual orientation in place of acknowledging that the person is a person. So now we might say gay people or bisexual people or pansexual people or queer people, etc. And so as you can see, you know, when we see the word transgendered, you're not a transgendered. You're a transgender person, as it says there. And so a lot of folks, when they hear these terms, it's a turnoff, and it's gender affirmation surgery. Nothing's being reassigned, or it's not sex change. Those are terms that were used back in the day. But, you know, times have changed, you know, and same with the word transgendered. Sometimes the word, you know, we hear the word transition is another way, like someone transitions from one sex to the other sex. They're not transgendering. It's grammar again, but it's just something to keep in mind, because most of the time the best rule is just to ask people how do they define their own gender and sexual orientation, and use their language. So if a trans person says, I knew I was a transgender when, you wouldn't want to correct them and say, not a transgender, just transgender. Sexual and gender minority people have already suffered from other people defining their identities for generations. So let your patient, or maybe a colleague even, be the experts on themselves. And just another word I want to throw out here that's problematic, and it's a word that sometimes people hear, something called dead naming. So we want to be careful. The dead naming basically means when you refer to a trans or non-binary person by a name they used prior to transitioning, such as their birth name. Now, sometimes this can be difficult, because if somebody hasn't had a chance to change things on their license or things like that, you know, their legal documents, that dead name could be on there. Hence, sometimes it's best to go with, you know, what name would you like me to use with you today? Even if you see a name on there, it's always nice to double check with that person, just in case that's not the true name they want to be used today. And so one thing that I like to say is, you know, you're using the same principles when you think about asking questions of clients and colleagues as you do when asking about and using pronouns. It's all about respect and willingness to learn. And these are just some questions that you can ask yourself before you ask a question of a patient or anyone. They're really great for anyone that you're talking with. And there's a surprising number of questions you might find that you don't ask after running through these 4 tests. So it's simple. Why do I want to know this about this person? How might it impact the person I am asking? Do I need to know it to do my job? And how can I ask it in the most respectful way? Simple questions, but you'd be surprised when you think about what those answers are before you move forward, what might make you change how you would ask a question of your client or your patient. And just a little bit on other sample language of using like non-gendered language. So thinking about how we do ask things. So a lot of times people say, how can I help you, sir? How can I help you, ma'am? Just think about how can I make that not so one binary gender. So maybe I might say, how can I help you? Or do you have a husband? Are you in a relationship? Instead of assuming that that person has a husband based on what you're seeing in front of you, right? When will the project be complete? You know, if you're not sure of the person's gender, when will their project be complete? Just thinking like where the pronoun that's usually she or her or he or him, if we're not sure what that pronoun is, how can we just like take the gender away so that people can feel a bit more comfortable to really just be themselves with you, for one. Because I do notice it when people switched out that I've caught people where even my colleagues, something people use a lot is "you guys." Hey, you guys. And I've caught my colleagues will say they'll catch themselves, even my training team, and they're like, "Oh, I'm going to use y'all." And I know we're not in Texas, but y'all really works. Or hey y'all instead of hey guys. That again is like, oh, we're not all guys here. Think about how we use language as we move through this, as you move through the work that you do. And really, I feel like y'all are smart people. You did the thumbs down at the beginning, and really this is just about you thinking about this as you work with your patients or clients. I don't know how you describe folks that you work with. And treat people as people. This is really what it's about. Be respectful. There's really no magic to this, is what I like to say. We all are going to probably make the mistake. I make the mistake sometimes of misgendering people. I have to catch myself. Just because I identify as non-binary does not mean I'm a perfect person. And I think you need to remember that we all are different. Those of us that identify as non-binary or trans, whatever our identity is, we all will have different stories that we bring to the table. And if you're open to hearing them, people will likely share them with you. And so that's really all I have for today. And if there's any questions, I'd be happy to stay on for a minute. And that's my thank you slide, just so you can see it. I think you already have our website where you can find me. But I'm also really open to, if you have questions later, you can email me. If I don't have the answer, I'll get it for you. But if we have a few minutes, I'd be happy to answer any questions now. So thank you very much. I appreciate being here with you all today.